How does biostatistics apply to USMLE Step 3 clinical scenarios? Imagine you're in a busy clinic, trying to decide if a patient has a certain disease based on test results. How do you know if the test is reliable? This is where biostatistics comes into play. On the United States medical licensing examination, especially in Step 3, you will see many clinical cases that requiring you to interpret data and make decisions. Biostatistics helps you understand how to evaluate diagnostic tests by looking at sensitivity and specificity. Sensitivity tells you how good a test is at catching true positives, while specificity shows how well it identifies true negatives. These numbers help you decide if a test is worth ordering or if it might lead to false alarms. You will also encounter positive and negative predictive values. These tell you the chances that a patient actually has or does not have a disease based on test results. For example, if a test has a high positive predictive value, a positive result strongly suggests the patient truly has the condition. This is important when deciding whether to start treatment. When analyzing data in clinical vignettes, you might see a table showing test results and disease prevalence. Knowing how to interpret this data helps you determine the likelihood of disease in a patient. Another key concept is risk ratios, which compare the chance of an outcome with and without exposure to a risk factor. For example, if smoking increases the risk of lung cancer, the risk ratio quantifies how much higher that risk is. Confidence intervals are also used to show the range within which the true value likely falls. A narrow confidence interval indicates more precise data, which can influence your clinical decisions. In the exam, you might be asked to calculate or interpret these values to decide if a treatment is effective or if a diagnostic test is appropriate. About 11 to 13% of questions on Step 3 involve biostatistics, so understanding these concepts is essential. They are often embedded in case scenarios, not just standalone questions. This reflects real-world medicine, where statistical reasoning guides diagnosis, prognosis, and treatment choices. To prepare, practice questions that combine clinical information with biostatistical analysis. Make quick reference guides for formulas and concepts. Get comfortable interpreting data from case reports or graphs. This way, when you see a clinical scenario on the exam, you can quickly analyze the data and make confident decisions. In short, biostatistics on the United States medical licensing examination helps you interpret epidemiological data and make evidence-based choices. It supports accurate diagnosis, risk assessment, and treatment planning. Mastering these skills will help you become a more competent and confident clinician.